Yeah, hi, I'm Dr. Sajjan, and your good name?
My name is Nishil.
Nishil, yes.
Yeah, I'm Arjun.
Arjun. Hi. So, where are you, Nishil, from?
I am from Kerala, Kannur.
I'm from Kerala, Malappuram.
Manappuram, right. That's great. So, you guys are doing your MBBS in abroad. Which country?
I am doing in Vladivostok in Far Eastern Federal University,
Russia.
Russia.
Yeah, me too, sir.
You're in the Russia, all right? Okay. So, see, what happens is, of course, when you are in India, you have been trained in different languages like English or in the local language which you have. So, when you go to a different country, we know that you have to learn a different language also, right? So you guys are in now which year of MBBS?
We are in second year and going. We finished our second year, going
You're
to
in
third year. Yeah.
Right, you're in third year MBBS. So do you know Russian language now?
Yeah, somebody know. We studied.
You studied. So they teach you Russian language?
Yeah. They weekly we have twice class.
Okay, weekly twice classes you have. And total how many hours of teaching they do for Russian itself for the language?
2 hours.
2 hours in
In a day.
a day. Okay, that's right. So that's a good number of them. So they will teach and train you to learn Russian language, right? And do you think it's important to learn Russian language?
Yeah, it's important for us to communicate to normal peoples, and after internship or for doing practice, it's important for to communicate to patients and
Patience and all, right? So that becomes very important. Do you feel? What do you feel? Learning Russian language was like when you studied. Is it difficult, or can our students who are coming from India also can learn? Like how difficult is that?
yeah, when compared to, as my friend said, compared to China and all, it's quite easy.
Okay.
We can study.
You can study Russian language, right? I see remembering Russian the writing style. It's more of English patterns is there, right?
Some letters are
Crossbreed of English, you can tell. So a lot of English letters in that.
Yeah.
Okay, great. So could you just talk to each other in Russian language, like what's your name, and just have a small conversation. Let us see how it sounds. So you can just ask him something and he will reply for that.
What's your name? I'll ask. Как вас зовут?
Меня зовут Arjun. First we should say Здравствуйте. It means hello.
Okay.
Hello. Then
Hello. Привет also.
Okay, whatever. Yeah, they told something I didn't understand. But fine, that's great. So you guys are in third year and you know how to talk to the patients, right? The basically, and also in day-to-day life when you go to the cities and other places, you have to know the language. Great. So other than that, so what about your studies? Do they teach in Russian language or like you learn in English language?
No, every subjects are taught in English only.
English language. Okay. And writing also you should write in English only.
Yeah, writing also.
Okay. So only when it comes to clinicals, when you go to the wards or see the patients, and when you have to talk to the patients, then I think the Russian language comes in, right?
Yeah, it's only because most of the patients don't know English.
Okay.
Yeah, that's it.
So there are patients who know English.
Yeah, the students who studies in university usually know somewhat. They know.
They know. Right. So what's your overall experience? You are in third year MBBS now doing in Russia. So for our students who are planning to go abroad, so as an Indians coming to this country and getting customized and all those things, what is your overall experience about it, and what do you suggest for the students? What should they do?
We had a good experience in Russia. According to language, it's good. It's good to communicate. It's pure, and we love.
So the language is one of the part of the curriculum which you have to get to know, right? But it doesn't make a hindrance, okay? Because entire thing happens in English. Only that interaction with the patients, of course, it has to be in the local language. Even if you are studying, even if you get a seat from Kerala to India, Kerala to Karnataka, you have to learn Kannada language. So, however, any country we go, any state you go, you have to learn the local language, right?
And also, I want to tell, in our university, there is chances for other students to learn in many other languages without any fees on German, China, like that.
Oh, so they teach different languages and there is no fees for that, and you can go and learn. Oh, that's a wonderful thing, right? That's one of the added skills which you can add to that. Okay, that's great. So all the best, both of you. Okay, all the best for your future. We'll see. Yeah, thank you.
The first book of its kind in India to give practical information on the NEET exam and medical career opportunities in India and abroad, authored by Dr. Sajjan Madapadi, International Medical Consultant. The author gives a complete insight into NEET UG exam statistics of previous years with regards to cutoff scores, cutoff ranking, and seat matrix. He also gives a brief overview of all the healthcare professions and career opportunities in the field of MBBS, BDS, Ayush, Allied Health, BSc courses, and many more opportunities are discussed. The author also opens the door for a golden opportunity to those students who could not get admissions in India can still study MBBS in abroad in government medical universities at a low cost fee starting from 3 lakhs per year. A must-have book for all the pre-university 11th and 12th science students. For more details, visit our website medicalcareerguidance.in or call to 8100 999 222 for guidance and assistance.